The Expert on AM 1230 WFAS. I'm Bob Barnum. This is the show where we take someone who has a business or has a service of some sort, and we talk to them about it for about a half an hour. And you can ask questions, too, at 914-693-5700. And today, our guest, Dr. Donelli from RD Dental in Hartsdale. Dr. Donelli, welcome.
Welcome, Bob. It's a real pleasure being here. WFAS is a station we have on all the time, and we particularly like your program. It's most informative.
Well, thank you very much. Now, tell me, you're from RD Dental. Tell us about RD Dental in general first.
Well, RD Dental, we've been in existence about 40 years now in Hartsdale, on East Hartsdale Avenue. We're a general practice. We handle all forms of dentistry, even though we emphasize cosmetics and restorative dentistry. That means, major problems of your jaw and of your teeth, with a real emphasis in cosmetics. But we are a full-service general practice in Hartsdale.
So you handle things like braces. I remember those from my childhood with great fondness.
Well, to tell you the truth, that nowadays we use Invisalign, which is the kind of braces that you had with wires and things that came loose and broke no longer exist. The method that is being done today, particularly for adults, is marvelous, and I think today in dentistry it's the major way that braces or orthodontics is being done. It's called Invisalign. It's done with clear trays. You can't see it. You can talk. You can be yourself. Nobody has any idea you have it in your mouth, and it moves teeth wonderfully.
And I remember a lot of pain was involved with braces. Is it at least reduced with Invisalign?
Tremendously reduced, because you don't have the wire problem, and you don't have the coming loose problem and things sticking around your teeth and things breaking loose and all that kind of stuff. This has just been a marvel. And as I said, salespeople, people like yourself, I have people that are on radio that are wearing Invisalign and wearing this clear, it's a clear tray, and they have no trouble speaking, and you have no idea that it's even in place. So it's been great. So
a person wearing it might forget he's got it on.
I tell you the truth, they do, because the one thing you don't do is you don't eat your meal with it on, and some people kind of forget because it is so comfortable. It's very comfortable, but in any case, that is how a lot of orthodontics is being done today.
Well, you say you're a general practitioner too, and you do teeth cleaning, obviously. How often should someone get that? Because I've been told that I should get it every 3 months, and I've been getting it every 6 months.
It's really customized, Bob. Routinely, people here have your teeth cleaned every 6 months, which I would say probably for the population at large is not a bad idea. It's a pretty good interval. However, if you think about it, people differ, and what we do in our office is we actually customize your period for you. So it could be 6 months, it could be 4 months, like yourself, it could be 3, it could be 8, it could be 10, it could be a whole year. It really kind of depends on what you need. That's probably the best way of going about it.
I see. Again, this is Ask the Expert on AM 1230 WFAS. Speaking with Dr. Donelli from RD Dental in Hartsdale, and you can also join in the conversation by calling 693-5700. That's a 914 area code. Now, how do you prevent tooth decay and gum disease in reality? I mean, is there special toothpaste that you recommend, or what?
That's a very good question. Gum disease and tooth decay are caused by the same thing, which is bacteria. They're different types of bacteria, but it is bacterial. They're both infections, really. One's an infection of the tooth, and one's an infection of the gums. So the way you deal with it is you got to get the bugs, you got to get the bacteria off your gums and off your teeth. And a lot of people kind of concentrate on the top of their teeth where they chew, and they really don't brush their gums or get between their teeth. So the best way is the ways you probably already know. You brush your teeth, electric toothbrush we prefer. Use dental floss or a water pick or something to get between your teeth, which is 1/3 of the area of your teeth. Or use a mouthwash that kills bacteria for at least a period of time. Using fluorides, which will make your teeth more resistant. All this helps to prevent tooth decay and to cut down on damage done by bacteria.